Hello everyone, and welcome to our video, Home Exercise Therapy for Rotator Cuff Pathology. My name is Dr. Earl, and I'm a family medicine resident with a special interest in sports medicine. I created this video with the help of Dr. Robert Lee at the Waterloo Sports Medicine Centre. Our goal for creating this video was to help our patients if they're unable to get into physiotherapy or they had forgotten how to do the exercises that they received from their therapist. So, let's get started. If you're going to complete this exercise therapy in one session, there are some items that you should gather before starting. These include a weight or canned food item that we'll use for pendulum exercises, a small hand towel that we'll use to make sure that we're in proper positioning, therapy band for resistance exercise, an assistive device that should be 2 to 3 feet long, and some of the items around the home that you could use are a hockey stick, a broomstick or mop handle, or if you happen to have it at your bedside, a cane. Once we have these items, then we're ready to get started. This first group of exercises is called the pendulum. So the idea here is that we're going to be relaxing the overlying deltoid and pectoral muscles so that we can stretch out and warm up the underlying rotator cuff muscles. So what we need here is any table or countertop or chair to help support our weight while we get into position, and then any small weight that you have around the home or canned food, anything that you'll be able to grasp easily to give you some weight. So what you do is you get into position in a slightly flexed posture, you let your injured arm hang low, and I like to think of it as a spaghetti noodle, so you're just very nice and loose. And then you use the rest of your body, not actively swinging with your arm, but just using the rest of your body to move your arm through first into a circular motion. And I do that for about 30 seconds. Following that 30 seconds, you move into forward-backward motion. And after that 30 seconds, into lateral motion. So that's a good way to work on loosening up and warming up the rotator cuff muscles. So we can start out doing a shoulder shrug. So that's where we bring our shoulders and arms up, and the goal is not to squeeze the head down, but actually try and concentrate on just pulling these shoulders up. And you may feel a small stretch just in the back, right around here, the lower trapezius. So you pull the shoulders up, hold it, and then relax. You can do 10 or more shoulder shrugs. And then I'll just turn to the side to show you better. You can do a shoulder circles. So that's where you bring the shoulders forward, up, back, and down. And then you want to just keep doing that. So you can do 10 or more shoulder circles, and this just helps with your range of motion and to get your traps and your other muscles around the shoulder girdle warmed up and ready for exercise. Okay, and this group of exercise is called the table slide. And this idea here is to take the weight of your arm off the rotator cuff muscle, but still allow you to do a full range of motion. So the first thing here, we're imitating the movement of full flexion, but taking off that weight. So you place your arm down on either your tabletop or countertop, and then you can reach forward to get you some movement, and then just using your upper body to slide forward, we can get ourselves into near full flexion. And you can do that repeatedly until you go out, until you feel a light stretch, hold it for a period of 10 to 30 seconds, and then you can do multiple repetitions of that. You can also use this technique to move into an abduction range of motion, and that just requires that you change the angle. So you'll be using the countertop, you initially slide out, and then leaning to the side, you can get yourself into near full range with the weight of your arm removed by the table. Okay? Okay everyone, and the next group of exercises that we can use as a progression from the table slides is called the wall climb. The idea here is that we'll get you moving into full flexion and full abduction of the shoulder while using the wall to give you some support to take the load of your arm off of that injured rotator cuff. So you need to step towards the wall, give yourself some support by pressing against the wall, and then you slowly raise the arm up until you feel a light stretch, and then you'll maintain at that position for a period of 10 to 30 seconds. Following that, you can relax down to give yourself a break, and then climb the hand back up. And you can use this technique to get into near full abduction. Following that, you can do forward flexion with this same technique. That will require that you turn yourself towards the wall, again pushing on the wall, climbing up until you feel a light stretch, holding for 10 to 30 seconds, and then again you can use the technique of sliding down to give yourself a rest, and then you can go back up, and this will again get you full range of motion passively while you're using the wall to take off a lot of the weight on your injured rotator cuff muscles. Okay everyone, and now I have a progression where we can use assistive devices in the home to help us go through a full range of motion while varying the amount of assistance that we give with our healthy arm. Some of the devices that you can use in the home are things like a cane, if you have that at your bedside or chair side, or if you're at a different level of fitness, you can be using other items like a hockey stick to support you. So how this will work, what I want to do is help you move through full abduction, forward flexion, external rotation, and internal rotation, but while taking off some of the weight with your assistive device. So how you'll do that, this is my healthy arm here, and this is what I'll be bearing the weight with, and this is my injured arm. If I wanted to move into abduction, I'd be bearing the weight with my healthy arm while guiding my injured arm into full abduction. This can be done for multiple reps, and you can vary how much assistance you're using the healthy arm to support. Then there's forward flexion, and I would just be again grasping the end of the assistive device and moving my arm into full forward flexion. If I wanted to do external rotation, the same idea, grasping the device and slowly guiding my arm into full external rotation. And then to show you internal rotation, I'll just show you from the back. So my injured arm would grasp the device, and then my healthy arm would be pulling me into a more complete internal rotation. Okay, so that's how we can use our assistive devices to help us move through a full range of motion. For the next group of exercises, we're going to be doing some resistance training to help with strength and endurance of the rotator cuff muscles. To do that, we're using some TheraBand, and this is material that you can get at different resistances, so different colors will give you different amounts of resistance. So to use it for these exercises, we just tie a simple loop into the TheraBand tubing, and then you just put it on the opposite side of the door handle, and then close the door to secure it in place. Now we have something that we can pull on and will give us resistance for our exercises. The first exercise that we're going to do is called the external rotation, and for that a helpful tool is just a rolled up hand towel, and this is useful for getting us into proper positioning, and it gives us feedback. So you put it underneath the elbow, just between your elbow and your body, and that gets your arm into a nice straight down posture. And this makes sure that you're holding your arm in and close to your body and not letting it wing out to the side, because the towel will fall and it will give you instant feedback on whether you need to correct your posture. So for that first group of exercises, the external rotation, we're going to get into our good positioning. So we have 90 degrees of flexion in the arm, and then we're going to position the hand straight out from our body and just stepping away to give us some resistance in the TheraBand. And then you want to go from this straightforward posture out to about 45 degrees and back. That would be one repetition. And you want to do that nice and slow. We're looking for a controlled movement out to 45 and back to straight. And you can do this for 3 sets of 10 or... Okay. Now the second exercise, we use the same towel trick, and I'll show you on the opposite arm. You put the towel in between your elbow and your body. You'll be, again, in a 90-degree flexion of your elbow and straight out in front of your body, and this exercise is called internal rotation. So what we're doing here, we step away to get the tension in the TheraBand, and then we're moving forward into about 45 degrees, moving the palm towards your body, and that will be internal rotation. Again, a slow, controlled movement is what we're looking for. Okay? This last group of exercises is called Ys, Ts, and Ws, and the goal here is that we're going to be working on all of the muscles around the shoulder blade or the scapula, and it's to build strength, endurance, and help us learn the proper positioning of the scapula or shoulder blade in multiple areas or positions of the arm. So to do that, we need, at home you can use a bed to get into proper position, and I'll just turn around to show you what the positions are. So you're going to be moving down and back, pulling the shoulder down and pushing out through the fingertips, and that would be a W, a T, out straight to the side, pushing out through the fingertips and squeezing, and then forward would be a Y. Okay? But you'll be down on the bed in position. The proper positioning for W's, Y's, and T's would be on the edge of your bed, just so that you can easily hang your arm over the side of the bed. And then you can lie down, face on your palm. It's a nice comfortable position, letting the arm hang down loose. And then when you're going to do a repetition, you'd be pushing out through the fingertips and then out and to the back. Squeezing there, and you can do multiple repetitions. So that would be the W. Then doing the T, same starting position, pushing out through the fingertips and squeezing back. And the final position would be our Y. So we're going into the same position, out forward and at an angle, making sure we push out through the fingertips Okay, and that's our final group of exercises, the W's, Y's, and T's.